and David on the secured third tranche of Abuja loot to the tune of $321 million to be repatriated by the federal government in New Jersey, USA.
For me, it's something we must commend this government for. We must commend President Buhari for providing this huge opportunity, because without government support, civil society like us would have not had access to the data.
Information and Culture Minister Lai Mohammed has restated the need for a responsible and fair media in Nigeria. The minister stated this when he granted audience to the Fin ambassador to Nigeria in Abuja.
No intention and does not tamper with the freedom of speech or freedom of individuals. But more often than not, we do confuse activists and politicians. We confuse them with journalists.
17,000 people have been infected by coronavirus globally. To this end, the Chinese government is reassuring Nigerians that the virus will soon be a thing of the past, as it is improving on current efforts with the support of other countries to address the disease.
We've taken all necessary measures to curb this epidemic. So as WHO recognized, China has been doing more even than what is required of an emergency. So I think the whole nation has been mobilized to curb it.
Federal Road Safety Corps says it is determined to end the abuse of sirens, spy number plates and incessant covering of vehicle number plates in the country. To this end, the FRSC Corps Marshal Boboye Oyeyemi met the Inspector General of Police, Mohammed Adamu, for the commencement of strategic operations towards ending them.
I think we need joint collaboration. This issue of covering of number plates is criminal. There is no... I've checked all the traffic laws of the 36 states and FCT, our traffic regulations. There's no law that authorizes any vehicle's number plate to be covered. We need to sanitize this country when it comes to this level of lawlessness.
In the whole of West Africa, it is this country that suffers most in terms of vehicles that are being stolen on daily basis. We cannot do it alone, you cannot do it alone, and we are serving the same nation. Therefore, we must cooperate to make sure that the services that are needed are provided.
And that is the news for now. Good Morning Nigeria continues with Kingsley and Jume after this break.
Now, federal government offers for subscription February 2027's bond. These are more business news with Abdul Karim Zurmi.
The federal government this Monday offered for subscription February 2020 bonds. The bond comes in 2 and 3 years tenure, maturing 2022 and 2023 with February 7th as the closing date. The 2-year paper is at an interest rate of 5.91%, while the 3-year paper is 6.91%. Meanwhile, fears over the coronavirus triggered sharp fall in Chinese shares when the market reopened after the Lunar New Year holiday, making it the biggest fall in 4 years. The virus has created alarm due to it spreading quickly, and much about it is still unknown. And now, let's head to the floor of the Nigerian Stock Exchange to see how the market fared on the 3rd of February 2020. With business news, Abdul Karim Zurmi.
Thank you very much, Abdul Karim, there for the business package. Next for us is newspaper review.
our newspaper reviewer, Bayo Tiobi, is in the studio. Good morning, Bayo.
Thank you, Juma. Good morning. Good morning, Kefli.
All right, Bayo.
Good morning, Nigeria.
Okay, we have just two newspapers this morning, Daily Trust and the Leadership. From the Daily Trust newspaper, the lead story is on World Cancer Day, which is also the kicker for the headline. Only 8 teaching hospitals have radiotherapy machines. With a rider, disease kills 280,000 Nigerians in 4 years. And you'll find the illustration on the front page of the Daily Trust very helpful in this regard. The numbers are there. Can we see the illustration on the front page of the Daily Trust? All right, it says 2016 to date, you see over 280,000 Nigerians have lost their lives to cancer. That's in the last 4 years. And annually, you have 80,000 deaths from cancer in the country. And the source, of course, is from the Nigerian Cancer Society. From the WHO, it says that in 2018 alone, there were over 70,000 deaths arising from cancer. And 3 most common cancers in Nigeria. Number 1, breast cancer, as you can see there on the front page. Number 2, cervical cancer. And 3, prostate cancer. So those are the figures there. But coming again to part of the illustration there, it says treatment. Only 8 cancer centers with radiotherapy machines across Nigeria. Out of these, only 2 have been functioning properly since 2019. Now, cervical cancer in Nigeria, 99% preventable, but over 29 women die of the ailment every day. That's in Nigeria. And breast cancer kills over 31 Nigerian women each day. And the source for that information is Project Pink Blue. Now, prostate cancer is also indicated there. It says it is the leading cause of cancer deaths in men, that's Nigerian men, as it kills about 15 Nigerian men each day. So that's the lead story for the Daily Trust newspaper. There are other headlines there. Just below the illustration there, right at the foot of the front page, port congestion worsens as overtime cargo hampers operations. Bandits kill 1, abduct imam and 19 in Niger. That's page 44. Insecurity, federal government to recruit more troops. Details on page 8. And very quickly, below the nameplate of the Daily Trust newspaper, cure found for coronavirus. That's a claim according to China, with details on page 6. And on page 20, discos raise meter and electricity costs as consumers kick. And on page 42, in detail, is a story with the headline, Obaseki seeks Oshomole's arrest. Petitions IG, Inspector General of Police and DSS.
Quite interesting there. And then coming from the Leadership newspaper, just below the masthead, plethora of cases suffocating the Supreme Court. That's coming from the Chief Justice of Nigeria. We are ready to complete Ajaokuta Steel. That's the story is coming from the Russian envoy, and you find that story on page 6. And then the kicker for this, for the Leadership newspaper today, is World Cancer Day. No respite for Nigerian patients, with riders cause dearth of experts, equipment hamper treatment. Only 7 cancer centers functional in Nigeria. Country has only 6 clinical oncologists as against 500 WHO benchmark. That's the World Health Organization. And at the bottom plate of the Leadership newspaper, Edo APC crisis. Obaseki writes IGP demands Oshomole's arrest. That story is on page 6. Rivers government seals off NLC secretariat over minimum wage. You find that in-depth analysis on page 9. And FG to revive abandoned fishing terminals in Akwa Ibom. That story is on page 32. Nigerian Air Force unveils another key 9 wing in Bauchi. Find that story on page 12. Bio.
Yes, I'm worried about the 2 situation reports about remembering World Cancer Day, and also pinpointing that in Nigeria today, the specialist hospital, teaching hospitals that are supposed to be the tertiary level of healthcare, have facilities that do not work. And everybody knows that early detection increases the chances of cure from cancer.
Exactly.
And if facilities at the hospital are not working, then what are the chances? And therefore, the population of deaths that have been recorded for cancer is certainly going to increase, except something is done very quickly. And the sad thing is that the professionals, yes, oncologists are in a short supply, but the health professionals, we have them. What is not available is the facilities. I told you, in 1989, I was on the NTA team to Saudi 89, and Saudi Arabia had established a tall, multi-story building sports hospital. The professor in charge was a Nigerian. And when we asked the prof, what are you doing here? He said, well, here I have the facilities, I can do the job. I get the money, but I would prefer I had the facilities at home to be able to provide these services for my people. So the essence of healthcare and the intention, if it is we are to challenge cancer, is to provide facilities so that cancer, when detected early, can be cured. I have instances of knowing 2 persons who went for breast screening, and for 3 weeks they couldn't get their results. Eventually they gave up because the result was not forthcoming. So something has to be done about that. Now, returning about the issues of security, Vice President Professor Yemi Osinbajo has indicated that there will be need to increase recruitment into military and other platforms as a means of beefing up the security. He revealed this when an association of Arewa Pastors Forum paid him what they describe as a peace and goodwill visit. The Vice President revealed that there are going to be collaborative efforts to ensure that local vigilante and civilian JTF were considered as a matter of last resort to help beef up security. He also, over last weekend, had visited Ogun State, where he had audience with the Akaribu of Remo as well as the Awujale of Ijebuland, and the issue was based on the directive by Mr. President to consult these traditional rulers and first-class traditional rulers, and also persons in the local settings to enhance the objective of security. Talking about enhancing objective of security, community policing is the new bride on the horizon. Community policing, and the Inspector General of Police has given instructions to all police command to begin screening persons that are to be recruited as special constable to function under community policing. But there are some confusion here. Those who are to be recruited are not to be given a new employment as such. From the guideline provided, those to be recruited are people who are already employed, because nobody is going to be paid a salary as a special constable under the community policing. So the initiative is people who volunteer, and when you volunteer, you will be screened. After you are screened and certified, then you can be enlisted into the community policing constable. They are likely to be paid stipends, but there is no salary. So those who think it is an opportunity for recruitment, it is not. It is separate from the 10,000 men that the president gave directives to be employed into the police every year. As far as that is concerned, the commissioner of police in Ekiti says that they have now distributed forms from the state command up to the divisional police level to be distributed for persons who are interested to serve in the community policing. The first PRO has also clarified that the initiative for special constable will not be paid any salary, but they may be given some what is described as a honorarium or stipend. He informed those who think that it is an opportunity to get engaged in the police that is not the intention. He says that professionals, journalists, lawyers, doctors, teachers, and even traders are expected to come and volunteer to be part of it. So, Kingsley, if you want to offer your services for community policing, you are welcome.
You offer his legal services as well.
There's no age restriction?
No age restriction.
There is age restriction, yes. There is
But
age
why?
restriction.
Community policing?
Age is between 21 years and 50.
or 50?
Yes, I will apply.
And what, you know, at least it will give an avenue for our youths out there who would like, maybe if they excel well in community policing, might be integrated into the police force.
Well,
But when you say
false
stipends,
hope, you may don't begin to give people false hope. They have clarified that.
yes, what I'm trying
they
to
must
say
be
is,
employed.
if you must be employed, like if I want to be part of a community policing in my area, with this kind of job that I do, where is the time?
Well, your own kind of job may not permit you with the time.
But you know, but I'm sorry, while we are talking about community policing, and we keep hearing about the inadequacy of existing police personnel, there's something that we haven't been able to solve in this country for some decades now. I mean, each time you have the directive, you hear the directive is given, but it's often observed more in the breach. You have more police officers, apparently, on private guard duties.
Yes.
Private guard, you go to some offices and you see 5 or so policemen, some of them very, very well starched uniforms, and some of them of the mobile unit. Their shoes are shiny. They prefer such VIP posting rather than being on the beat. I mean, you imagine what this country would benefit from it if just half of the number of persons who are on private guard duties were to be deployed to be on the beat on the street.
Yes,
I mean, you're talking about you can go through virtually all Nigerian cities, including the FCT, and you will hardly find policemen who are on the beat.
Yes, I think I remember clearly during the tenure of the last IG, Inspector General of Police, the population of the police was said to be about 300,000. And he said about 150,000 were involved in that kind of responsibility that Kingsley just described. He even made a bold attempt to recall all of them, that all of them should return to their police beat for us. But that order was rescinded in less than a week. In less than a week, especially those that are attached to the politically exposed persons.
What politically exposed what? How many guards, police guards, does the British Prime Minister have? Ask yourself that. Have we not seen prime ministers in Europe or elsewhere who are trains and then riding bicycles? These are the reasons why we continue to have escalating instances of insecurity. So you secure yourself. If you go to the man's house in the village, he will have policemen who are guarding him there. You come to the city, you have policemen who are guarding him. You go to the office, you have policemen who are guarding him. And there are some of the ones who also make it very challenging to enforce the abuse of sirens, the regulation against the abuse of sirens, and the use of the so-called pilot vehicles with which they use to terrorize other motorists. Those pilot vehicles have no plate numbers. The FRSC Corps Marshal was complaining about that in our news bulletin just a while ago. They are the ones that will hood their plate numbers, and of course you cannot challenge them if they get into any traffic offense. How do you identify the vehicle? I mean, it's a major, everybody knows it's a major source of corruption, and unless and until you fight that, we're going to be wasting our time. And in any case, I think that the time has come for us to recognize this. Why should the money from the public purse be used to recruit, train and pay these police officers, and yet they are now assigned to private duties for the security of just something like carrying bags and umbrellas for. There's no way that happens anywhere on the earth.
Now, because the police are overwhelmed, you now have the military deployed to internal security. And yesterday, when the Senate President and the Speaker of the House of Representatives visited the President, and the issue of the service chiefs was raised, and it came out clearly that their primary responsibility, that of defending the territorial integrity of the nation from external aggression, they have been doing that perfectly well. The challenges we are having with internal security is primarily the responsibility of the police, and they are only coming to give support services. So you have this conflicting. You know this, Juma. You travel out of this country, and you will see policemen on beat patrol. Some of them on foot, some of them on bikes, some of them just walking up. And then of course they have their kits. And then you have the patrol vehicles that are also stationed. But you go through Nigerian cities, you will have, if any policeman you find on the street is off duty, and they're rushing off to go somewhere, even if a crime is happening in his view, he doesn't. People are fighting on the street, which is affray and an offense. He will just look the other way and say, "What concerns me?" Probably he's rushing off to go and guard the VIP where he will have his meal and then get extra pay.
Yes, quite.
There is an update on one story we read yesterday the chairman of the Christian Association of Nigeria, Reverend John Hayab, says that the attempted bomber who took an improvised device to a winner's church in Sabo Tesha in Kaduna was first identified himself as Muhammad Sani. It was after he was handed over to the police that he suddenly changed his name to Samuel Nathaniel. He says that a criminal is a criminal, and therefore people should not be encouraged to use religion as a cover-up for their criminality. And Pastor Hayab says that he knows of Muslims who bear Christian names like Paul and Christians who bear Islamic names like Muhammad. And therefore, if a crime is committed, persons involved should be treated as criminals and should not be allowed to hide under religious sentiment.
Exactly. I know going through the social media yesterday, there was a lot of sharing, Christians sharing that he's not a Christian, he's a Muslim, and it doesn't matter. He's a human being first, and the crime he committed is against other human beings. And there's no religion on earth that says anybody irrelevant of your faith should kill people or must kill people. I think in Nigeria we need to really sit down and analyze, crime itself. It's a very, very, very pathetic situation, and we are, propagating it in the social media, spreading false information, and it really gets down to the man on the street, and he believes it. Because he feels it is the fact.
Talking about the social media, yesterday there were two instances. The Senate president was at a forum, an open forum, on looking at his speech and the proposed social media bill. Yeah. And he emphasized categorically that the National Assembly is not out to gag the press. However, the dangers that social media poses with the kind of information they post, it requires checking. And he also emphasized that there are enough laws to check some of the intentions that is proposed in the so-called social media bill. At another instance, the ambassador of Finland was visiting the Minister of Information, and he also clarified that the intention of checking hate speech is not to gag the press. Press freedom is for information that is responsible. Naturally, if you pass out information that is irresponsible, if it affects an individual's reputation, that is why under the law, it can sue you for libel. If it is a criminal nature against the state, that is why you become liable for, what is that crime they call it now? Criminal libel against the state.
Against the state.
That is when you are so charged. So if you enjoy press freedom or freedom of expression,
no, you must respect the law too.
Your expression must be responsible and not either violate the right of another individual to a rightful reputation or be an incendiary that could cause public upheaval and confusion.
Okay, Bayo, now let's now go to the editorial which came in from the Daily Trust this morning. That's decongesting the ports and waterways, diligent implementation for proposed Bonny Warri seaports. And I'm just going to read a little. The Minister of Transport, Rotimi Amechi, announced that President Buhari has approved plans for the building of 2 new seaports in Bonny, River State and Warri Delta State as part of plans to improve maritime trade in the country. He stated this while speaking on railway infrastructure, progress and plan at the 2020 National Economic Outlook in Lagos last week. The minister's announcement comes just as the Nigerian Ports Authority moves to divert cargoes meant for the already congested Lagos ports to Port Harcourt and Calabar ports.
Well, the Honorable Minister, during that press briefing, made a revelation that I found very surprising. He said, in Nigeria, we do not have seaports. What we have now are river ports. And that is why, yes, government is going to build a seaport at Bonny and another seaport at Warri. Already, the Cross River State government is also taking the initiative to build a seaport at Calabar. That will go a long way to enhancing maritime trade and also cargo in and out of the country. However, the editorial is happening on the fact that there are so many agencies at the ports, and they contribute to part of the congestion. And some of the agencies, if their job is not relevant, they should be taken out of the port. There was also this system whereby if a ship was to discharge its cargo, it will first go to the Calabar port or Port Harcourt port to go and register with an agency before it will now come back to Lagos and discharge its goods. And this is because there was a previous arrangement for an entity that must register those ports before such as done. These are some of the reasons that gets the Lagos port very, very congested. If we have other alternative ports, it will go a long way if some of the cargoes are distributed to the ports. If not, those ports will be idle. It's good to build a seaport at Bonny and Warri, but if you continue to divert all cargo to one specific location, the whole exercise of diverting cargo to multi-ports so that you won't have congestion will be defeated.
All right, Baya Toyepe, we would like to thank you for being around this morning. We'll see you again tomorrow. Okay, it's Good Morning Nigeria, reaching you on the network service of the NTA. We'll take a short break now. When we return, we're dealing with issues of cancer and the options for prevention.
Thanks for rejoining us. Now, with so many types of cancer, according to experts, it has remained a killer disease in the world, especially when it is not detected early. Murjano to Adam Said put together this report to begin our discussion.
Every year, more people are diagnosed with cancer, with some cases resulting to death. Medical experts say the disease contributes significantly to health burden in Africa, especially with delay in diagnosis. Despite recent improved efforts of the federal government in treatment and survival chances, cancer is still seen as a death sentence.
Government focuses on prevention because prevention is better and cheaper than cure.
Creation of service centers so that, and also to put in place effective control measures that can now finally make us arrive at where we need to be as far as cancer control is concerned.
The World Cancer Day is an international day marked on February 4th to raise awareness as well as encourage cancer prevention, detection, and treatment. The theme for this year's World Cancer Day is I Am and I Will. It's all about you and your commitment to act in the fight against non-communicable diseases.
All right, now with us in the studios, would like to welcome a very familiar face is Dr. Bello Abubakar Mohammed, who is President, African Organization for Research and Training in Cancer. He's also, of course, a consultant radiation oncologist at the National Hospital here in Abuja. Dr. Bello, pleasure to have you again on Good Morning Nigeria.
Thank you for having me.
All right. Also here with us in the studios is another president, this time of the Nigerian Medical Association, Dr. Francis Fadule. Dr. Fadule, pleasure to have you with us on the program.
Thank you very much. My pleasure to be here.
Okay.
And from our Kano studio, we have Dr. Abubakar Bala, surgical oncologist and consultant general surgeon, Aminu Kano Teaching Hospital. It's a pleasure to have you join us. And head of radiation oncology, University of Nigeria Teaching Hospital. You're welcome to Good Morning Nigeria. You're welcome to Good Morning Nigeria. Yes, Lee.
All right. Gentlemen, once again, delighted to have you with us, which of course is World Cancer Day. And while we were reviewing our newspapers a while ago, you saw some of the figures on the front page of the Daily Trust newspaper. And what the numbers say, indeed, are quite scary. But there is also the issue of just seeking to first understand what cancer is about. We keep hearing about it, and then the scare that also accompanies it. Let's begin with Dr. Bello. I mean, we've always had you here to discuss issues of cancer, whether of a specific type, of a general type. Why cancer?
So, thank you very much again, and I have mentioned on this forum many times that the only most important risk factor of developing cancer basically is being human. Okay, so it's not an affliction by someone or somebody that doesn't like you and so on. Because in truth, what cancer entails basically is an uncontrolled proliferation or growth of any cell in the body. Okay, So we have mechanisms in the body that control the growth of each and every cell. When there is a mechanism that prevents that control, what is usually called mutation, then you are likely to have cancer. And of course, we do know that some cancers have real causes. Some we still don't know. We are still studying them. And it's good to note that most of our cancers, about 35% of the cancers that are prevalent in sub-Saharan Africa, that's Nigeria included, is as a result of infections. So these are basically preventable cancers. Okay, cervical cancer, cancer of the liver, cancer of the stomach, what is called gastric cancer, are all known to have causative agents. For instance, the cervical cancer is caused 99.7% of them will detect a human papilloma virus. Now, that virus has a vaccine. So if you can immunize all the children so that they don't get infected by the human papilloma virus, the chances are that over time you will eradicate completely cancer of the cervix. The same thing goes for, say, bladder cancer, which is in most instances as a result of an infection by schistosomiasis. Schistosoma, that's the causative agent, the schistosoma hematobium. So if you are able to eradicate that schistosoma hematobium, you are likely going to reduce most of the cancer of the bladder. Of course, there are other things that we do not know, and there are those that you cannot actually prevent. For those that you can't prevent, there are things that you can do to detect them early, because early detection and early treatment can actually save anybody's life.
Okay, thank you so much. And I'll come into Dr. Francis Faduele now. This year's theme is I am and I will. For me, I look at it as a call for strength and the will to live. So how does it come across somebody who has just been diagnosed with cancer? And what is the psychological effect on the patient?
Thank you very much. I think it's important for us to understand the area that people who are diagnosed with cancer and the psychological position they will be. In a country like Nigeria, diagnosis of cancer is almost a near-death sentence. Meanwhile, in other climes, the diagnosis may not mean anything much. And the reasons are not far-fetched. First, like Dr. Bello has said, if you have cancer diagnosed in its early stage, it can be well treated, properly treated, and we call something prognosis in medicine, which means the likelihood outcome, if it's going to be good or bad. I can tell you most times it can be very good. But if it is diagnosed late, apart from having very high cost in treatment, whichever way you want to treat it, sometimes it may be too late that you may not be able to get that. But importantly is the theme, I am and I will. And what we need to know is that they are focusing on preventable cancers. And the preventable cancers that are ravaging this part of this world, in Nigeria especially, is the cancer of the breast and cancer of the cervix. And I can tell you, for the two of them, we have a yellow or a red flag or a yellow flag that would have been in place for up to 10 years before the cancer actually becomes one that you cannot control easily. And that is the call for every one of us, to see that we key into getting it at those times and be able to treat it. For example,
cervical cancer outside this country. I can tell you, sometimes I went for a course in Australia, and I can tell you in Australia, if you have a cancer of the cervix, just one, is a case that they will call a lot of doctors, a lot of students to come and see, because it is almost totally eradicated. Okay? And same can be talked about cancer of the breast. So, apart from giving the immunization, which had been seen to have been able to take care of a lot, almost 70 or 80% of those who have come down with cancer, they do regular pap smear tests, okay, or other tests to check when the precancerous stage. But it is because government and the people in those countries have decided to have a policy on how to catch those who may have that cancer and treat them accordingly.
Okay, Dr. Fadule, thanks a lot. Let's go over to our Kano Network Center, where we earlier introduced Dr. Abubakar Bala, who is a surgical oncologist and also a consultant at the Ahmedu Kano Teaching Hospital. Dr. Bala, Dr. Bello says that cancer is available because one is a human being. And the question to then ask is, apart from what Dr. Fadule has said, focusing on cervical or breast cancer, is there any part of the body that is not susceptible to cancer, for instance? And what are the symptoms when you have the onset of cancer?
Very much. Once again, I'm Dr. Abubakar Bala. I'm a surgical oncologist. I work with Ahmedu Kano Teaching Hospital. Thank you for the question. I will have to say that cancer affects the whole body. It affects every organ in the human body. There's no organ that is exempted from having cancer, including the brain. Now, the symptoms of cancer, let's look at the commonest cancer, breast cancer. Actually, the patient usually presents with a lump. Like in our environment, these patients do not present early. They present with a mass in the breast. Sometimes it has formed a hole we call ulcer. And sometimes they can present with blood-stained nipple discharge, where they see blood coming out from the nipple. And sometimes they present with features of distant spread, which we call metastasis. That is, they may present with cough. They'll be bringing out bloody sputum, which we call hemoptysis. That may signify that they have a spread to the lungs. Sometimes they may present, patients with breast cancer, for example, may present with abdominal swellings, and as well as yellowish discoloration of the eyes, which may suggest that the cancer has spread to the liver. And then sometimes they may also present with headaches, convulsions, and even loss of consciousness, which may suggest that the cancer has spread to the brain. So the presentation of cancer, in summary, it can present as a local swelling with local symptoms, or it can present with symptoms of distant spread, which is metastasis. So therefore, in line with this is that in our environment, most of the cancers, breast cancer, cervical cancer, as well as prostate cancer, they do not present early. They present with features of advanced disease. And in such situation, cure is difficult to be achieved. Well, so in such situation, we offer them palliation. And in the course of palliation, our aim is to improve the quality of life so that these patients may not be cured, but at least to palliate their symptoms that they may present. Thank you very much.
Sorry, Dr. Bala, just explain to our viewers what you mean by, local symptoms, for instance. I mean, some of us will understand that. You were trying to describe what happens in the early stages of breast cancer. Say local symptoms or otherwise. What exactly are you talking about?
All right. Thank you very much. Thank you very much once again. What I mean by local symptoms is now for us to understand the way the presentation of cancer is that cancer starts as a single cell that proliferates and start increasing in size. So let's look at a patient with suspected, let's say, breast cancer. The local symptoms will be she will have a lump, which is a swelling in her breast. She may have some discharge from her nipple, which is usually blood-stained. She may have some hole, what we call ulcer, within the breast. She may have some swellings within the armpit, which we call enlarged lymph nodes. And she may have other localized symptoms, like sometimes pain within the breast. And sometimes she may have some nipple retraction. That means the nipple will go in. So all these symptoms are localized within the organ affected. So those are what we call localized symptoms. And when symptoms are usually localized and they have not gone beyond the organ affected, in most cases, such kind of cancers can be treated properly, and patients can be cured. But in our environment, most of these patients, although they may have their primary localized symptoms, but they still have symptoms and evidence of distant spread. So localized symptoms are needed for the cancer to be properly staged. Because when symptoms are localized, there's no evidence of spread, they are early stage cancers. And early stage cancers can be treated with the aim, in most cases, of cure. Thank you very much.
Thank you so much. Now, we'll come back to you in the course of the program. We'll be going to Lagos now, where Dr. Nwankwo Kenneth Chima is a consultant radiation oncologist, Enugu, and head of radiation oncology, University of Nigeria Teaching Hospital in Enugu. You know, the World Health Organization has said that almost 41,000 Nigerians died of cancer in 2018. Projecting into 2020, that's a huge number. Can we look at easy ways of getting diagnosis and finding out that you have the disease? And do you need to seek another opinion from the opinion that has been given to you already by another doctor? How many do you need to go through to confirm that you really have it?
Thank you very much. Okay, I'm Nwankwo Kenneth. I'm from Radiation Oncologist, University of Nigeria, Enugu. Thank you for having me in the program. Okay, you're right. Cancer burden is enormous in the country. And many a times we have problem of diagnosis. Like you pointed out, at times you may need opinion or second opinions to get it right. What is the main diagnosis? You know, apart from doing all the localizing the tumor, doing radiological investigations to say this is the tumor. But let's say, for example, we're talking about breast cancer now. If you do mammography, you say, okay, this is the tumor, this is the size and all that. And then, of course, that is not the end of the diagnosis, because it hasn't told you exactly what is the make of the tissue diagnosis, and you need the tissue diagnosis to confirm. And then you do what is called biopsy, to go and take the tissue from it and study in the lab by a histopathologist. And that means you need a histopathological diagnosis to now specifically tell you it is this, intraductal carcinoma or lobular carcinoma or not that, because they find out that the tissue actually will guide you in the treatment, because you need it in treatment. And then because many a times, of course, if an individual is looking at this, maybe it becomes more like a personal opinion. But in modern time, you need what we call a multidisciplinary approach. You need other people to look at this thing too. Let's say one individual has said it's intraductal, and then you need another person to look at it to confirm that it is actually what the person said. So you usually need up to 2 people saying it. Otherwise, many a times you may need to go to another person to say, look at these things and tell me, is it really what the other one said? That becomes very important when you're dealing with situations where you have uncommon presentation of a tumor. If it's uncommon, and you have a diagnosis, of course, you may query the diagnosis until you get a second opinion. So many a times you may need a second opinion. In some cases, it's so clear, the symptoms, the signs, everything is so clear, and then the histology is in line with the symptoms, and you may go ahead with the management. But like I said, when you have uncommon presentations, you may need a second opinion to confirm. That is to talk about histopathology diagnosis and the final diagnosis. And then, like I mentioned about other radiological investigations, we should guide you in localizing the tumor and then in staging, like Dr. Bala has said. So you need not only one source, you need several investigations, you need several people to come together, and that points to the fact that cancer management in the world today is multidisciplinary, not only one person, not only one discipline, but several people coming together to make it better for the patient. Thank you.
All right, thanks a lot, Dr. Chima. Let's come back to our Abuja studios. Back again to Dr. Bello. Dr. Bello, I mean, it's one has heard over the decades, about the meaning of cancer and so on and so forth. But why the uncontrolled cell growth? Why? That's one. And 2, you also hear sometimes when medical experts like yourselves, we're having the studios today, said, oh, the cancer has spread. How does it spread? Uncontrolled, why uncontrolled growth? And then how does it spread? From one, is it jumping?
That's a very good and an interesting statement, whether it's jumping. Yes, you have what is called skip metastasis. Now, on a very serious note, as you are born, you tend to grow, okay? So, and as you are growing, cells are being formed and some die. So there is a mechanism in the body that controls that growth. That is why you don't grow to be 6 meters and so on. So there is a certain mechanism, and those mechanisms are controlled by the genes. And that control, sometimes for one reason or the other, is impaired. And when that happens, then the growth will tend to continue. So in other words, the genes that control the growth and the death of cells is somehow impaired or is mutated. And as a result, cancers can actually happen. And that is why we say that cancer in itself is a genetic disease. In other words, it's a mutation of genes. And because of so much research that is going on in the human genome, we are able to find so many mutations in the pathways of those controls, okay? And then we are now able to stop some of those mutations. And that is what is called actionable mutations. And so many cancers today are being treated as a genetic disease. In other words, you do what is called gene sequencing. You find the target where there is the mutation, and many pharmaceutical industry companies have developed drugs that are supposed to target those mutations. Those are called targeted drugs. And that's why I was talking to a colleague just in January in Egypt, and they are saying that very soon every cancer will be treated as a personalized disease. So if someone, Mr. A, has a colorectal cancer, which is cancer of the large bowel, he can go to the hospital and they will take a chunk of that tissue and analyze it and come out with actionable mutations and treat it specifically for that individual. When that happens, things like chemotherapy will no longer be in vogue. And this is something that is really going on around the world. Unfortunately, in sub-Saharan Africa and in Nigeria in particular, most of these things are not things that are being encouraged. In other words, we do not have funding to go ahead and develop things like molecular laboratories. Dr. Fadiole here is a pathologist, and he can attest to it that treatment of cancer today without proper pathological diagnosis is almost like not treating the cancer. So in other words, we must quickly try to develop those things. Otherwise, in the near future, we will not be able to treat our own cancers. When chemotherapy are no longer being produced, when you have individualized care, and we do not have enough laboratories to be able to do that individualized diagnosis for our patients. So we really need to move forward. We need to move so quickly so that we will be in the same line with the global community.
Well, Dr. Fadule, that's the other leg of my question. I mean, Dr. Bello answered it partially. When you hear that, the cancer has spread, what is meant, by that, and what aids the spread? They were treating him for maybe lung cancer, it has spread. How does it happen? Is that also preventable?
Well, I think I will want to answer that, but I just want to not correct something from what Dr. Bello has said, but to just emphasize the state we are. The current state we are not close to what Dr. Bello is hypothesizing.
Like on the scale of 1 to 10.
The treatment of cancer, the diagnosis of cancer in Nigeria today is near zero. Because for you to diagnose cancer as a histopathology, the only thing you have is your microscope. Cancer has gone beyond microscope and say this is intraductal, this is ductal, this is lobular. As he has said, you go to the gene, you go to the level of mutation. We don't do that. We don't even have that. Ordinary immunohistochemistry, for you to put them in different form, we don't have that. So we have a very terrible position in terms of diagnosis. We are not talking about treatment. But importantly, if a cell, because the cell has suddenly become uncontrolled in its growth, and it does happen every day in our division, in our body. But we have processes in which the body will know, okay, this cell is likely going to misbehave, the body will kill it. Okay? But sometimes this control, this safety gauge will just slip off. And once that cell passes through a process of cell division, then the cell will have offsprings that will not listen to any control. The moment they are not listening to any control, the cell will continue to grow. So you just see...
Like area boy.
Yes.
So you just see one part of this place. If you have one cell there, it gets out of control and it becomes bigger, and it will compress the whole structure, this shape, and it will deform it. It deforms it into a state in which even the blood supply and other cells that are there are killed because of their proliferation. Okay? And in the process of proliferation, like you have said, area boys, after they have finished taking over maybe a camp, they will now say, look, this place is not enough for us.
Then they'll spread.
They will just jump up and go and initiate other areas.
That is when there's no control.
That is, every cancer cell has no control. And they continue to grow ad infinitum till forever. What usually kills them is because you don't have enough blood supply, you don't have enough space, and they've compressed themselves that some of them will start dying. Then you have ulcer, like some other contributors have said. You have ulcer, but importantly, they get to a stage in which they want to leave that area to go and create new territory, and that is the time, like they jump, they spread. They can spread through the lymphatics, they can spread through the blood, and they can spread through jumping from, because we have one big space in the stomach, you can move from maybe the liver and just go to the colon or to other side. Okay? So, but importantly is, how do we diagnose, how do we prevent, how do we treat? And I think that is where Nigerian sector or Nigerians need to look at. We don't have enough equipment for diagnosis, and that is the terrible state in which we have found ourselves. And treatment, like they have said, almost all cancers that we have in Nigerians, amongst Nigerians, come very late. I have seen someone who they are good looking, they are healthy, and they will tell you that in 1976 they diagnosed cancer of the colon for them. In 1986 they have cancer of the skin. And you see them, they are all right, and it is because the diagnosis was early, was prompt, and treatment can be instituted early. And this is where I think Nigeria must look into to have policy. Okay, today it is evil for our women to be left to still die from cancer of the cervix, because cancer of the cervix will give 10 years before it comes, and the country has not in any way find a way to have a policy for our women to be taken care of so that they don't have cancer of the cervix. These are things that we need the government to put in place. We need to have maybe cervical screening tests, because we are not even graduated to this vaccine. In other countries, by age 9 to age 13, many of them are all children, ladies, are taking the vaccine for HPV. That will not make those ladies to have cancer of the cervix. We are not doing anything about it in this country, not to talk of cancer of the prostate or cancer of the breast. And I think these are areas that we will, as the country, the country is willing, I am and I will, and it is in the reduction of preventable cancer.
So what happened to the National Cancer Control Plan 2018 to 2022? Yes, how far have you gone, Dr. Bello?
So the Cancer Control Plan of the Federal Ministry of Health was actually launched sometime 2 years ago. And part of the things that we did, I was part of that production of that document, and part of the things that we did was to see what is the cost for implementing the Cancer Control Plan. And we found that it will cost about 97 billion naira to be able to implement everything from advocacy to treatment to palliation. All that is enshrined. So where do we start? Now, is the implementation, getting funds to implement all the things that are in the document, that is a major problem. You see, in this country, we do not lack expertise to formulate documents. But when it comes to implementation, then we all go to sleep. And for the last 2 years, sincerely, nothing fundamental has not happened. In other words, if we had started with institutionalizing national screening programs for cervical cancer, for breast cancer, for prostate cancer, and so on, which are all in the document, at least by now, probably in 2 years, would have seen maybe that from the 86% of patients that are presenting late, probably we have now 80. So that's something in the right direction. But that document is there. Implementation has not started. And tomorrow, hopefully, somebody will come and he will say, this document is not feasible, it's not good enough. Let's form another committee and let's start doing these things. So these things keep going on and on and on. And that is why we keep talking, that let government, if government is unable to implement some of the policy documents, let them involve private sector. Let them reduce the bureaucratic bottlenecks so that we can have proper implementation of the document. I'll give you an example. If we are talking that we don't have pathology in Nigeria to be able to make a proper diagnosis, why are we not encouraging private sector to develop pathology laboratories across the country? Every cancer patient that travels out of this country to go to India, Dubai, and all other countries don't go to government hospitals. They spend so much money in private hospitals, and that is where they get all these diagnoses. We have realized that government alone cannot do it, but government has the responsibility to make sure that there are policies that will encourage Nigerians to start setting up cancer centers, diagnostic centers, treatment centers, even palliative centers. We do not have hospices. You will see that a patient is dying of cancer and he's in a hospital when we know it's terminal. And he's occupying hospital bed for patients that should have been there to be treated, to be cured. Because there are no hospices. If we have hospices, those are patients that will go there for palliation of their symptoms, of their pains, and so on. So we have a very long way. We must make concerted effort. And that's what IOTIC, the African Organization on Research and Training, is trying to do. Engage governments at all levels and ask them the question, what is happening? Why are we not implementing cancer control? And I must say that the Federal Ministry of Health has done so well by producing that document. There are over 23 countries in Africa that don't have anything at all, whether cancer control plan, whether clinicians, whether equipment, and so on and so forth. But we must find a way of trying to implement if we want to move forward.
Okay, well, thank you very much, Dr. Bello. Let's return to Dr. Nwankwo Chima at our Enugu Network Center. Dr. Chima, I mean, give us a sense of what you know about the implementation, if any, of aspects of the National Cancer Control Plan 2018 to 2022. Look, the point is, we do hear a lot of noise about projects and programs by state governments and sometimes by local governments. But in terms of focusing on cancer, what has been the experience, for instance, in your location or in the neighboring areas?
As for implementation, you know, we always have problem with implementation. We have good policies, we draft good recommendations, but then to follow it is a problem. And here, I think the state have not been doing much in terms of that, although they are now trying to create awareness. well, but in terms of facilities and all that and training, we are still very, very behind. And then in terms of federal government, and for example, they are providing brachytherapy equipment in some centers now, and the UNTH is one of the centers that will benefit from the brachytherapy equipment. And there's building is ongoing. I think very soon they will install the equipment. So that is more or less the area we implemented so far. We're still hoping on further training and then and more facilities and even try to improve cancer care in this area. But for now, another thing is that we'll try to partner with private partnership. That equally has helped us to sustain our equipment. The equipment we'll have, University of Nigeria, some of us has been one of the centers that have been offering radiotherapy service for now, and it's because we partnered with a private initiative. So the implementation is still poor, but we hope that there will be improvements as time goes on. Thank you.
I'm still staying with you. How can cancer treatment, palliative care, and clinical trials, if this plan is implemented, be used to sort of eradicate cancer in Nigeria?
It will go a long way in eradicating cancer, there is no doubt, because you find out that you've noted that many a times, up to 70 to 80% of the times, patients come late with advanced disease that is potentially incurable. But when we implement those policies, one, there will be creation of awareness. People will know. People will be encouraged to present early. And when you present early, in the early stage, it's potentially curable. So that is to say that over time, if it's fully implemented, one, there will be early presentation with a stage where some of this cancer will be cured and the patients will live happily ever after. And then another thing is that treatment or management will be improved because you have facilities. I had Dr. Fadun has mentioned about death of our facilities in the country. Because for example, I read about one of your news saying about 8 teaching hospitals in the country has only radiotherapy facilities, and that is quite grossly low. So when we have facilities, then you don't have a lot of people crowding in one center, and then you have more time to attend to a patient, and then you give the patient quality time and quality treatment. So there is no doubt there will be improvement in the outcome of the patient, because many patients will be cured, and those that won't be cured, I think, will be managed very well. The palliative cases will receive adequate attention, because you know that a lot of our patients now go through a lot of pain. There is no morphine in many of the centers, and morphine is the main drug used to control some of these pains. And for example, in my center, there is no morphine now, and I believe in other centers in the country. So we need to implement that policy very well, so that it will enhance cancer control, cancer management, and then, of course, patients will be happier. Thank you.
All right. Thank you very much, Dr. Chima. Let's return to Dr. Bala in Kano. Dr. Bala, tell us what your experience has been. I mean, it's 2 years into the National Cancer Control Plan. What has been the experience, either in terms of subnational government intervention or collaboration with the private sector?
Thank you very much for the question. My personal experience with the National Cancer Control Plan of the country has been a two-edged sword. Before, let's say in the last 1.5 years, we have not had any much impact in my center with regards to the National Cancer Control Plan. because most of our patients, they come to the hospital with late disease. They present late, and they are often poor, and they are not in insurance. They are not having any health insurance coverage, and as such, they buy their drugs out of pocket. And treatment of cancer, as we all know, is very, very expensive. And as such patients, they find it difficult to cope. And as such, coupled with bad cultural practices where some people believe that cancer management can be best managed by traditional herbalists, as such patients are mismanaged. But recently in my center, I was opportune to attend a meeting just 2 weeks ago, where there's an initiative, there's a partnership between the federal government and some non-governmental organization where they are going to bring down the cost of cancer drugs, the common cancer drugs, about 16 of them, to the barest minimum. And as such, it was an initiative that we're very, very happy about. Myself and other cancer specialists within the hospital, the pediatric oncologists, the clinical oncologists, the radio oncologists, as well as all other specialists, the pharmacists, the nurse oncologists, we came together and we worked out a plan how we can ensure the success and implementation of that program. So in other words, what I'm trying to, the message I'm sending is that the plan needs to filter in, to spread to every nook and cranny of a corner of the country. Because, for example, in my center, as we are all aware, the population of Kano is about 20 million. And our hospital, Aminu Kano Teaching Hospital, cater for surrounding hospital states like Jigawa, Katsina. And as a result of that, we are talking about a population of 40 million. In my center, we do not have a radiotherapy machine. And without a radiotherapy machine, cancer treatment, as we have said earlier, is a multidisciplinary treatment. Without a properly functioning radiotherapy machine, honestly, a management of cancer is going to be very, very difficult and challenging for us. We need to send our patients to far places, and such centers to also have a very long waiting list. And those patients, we have little or no funds, they have no relative to stay with, and as a result of that, we don't get the best out of it. So I would like to say that this plan should permeate every nook and cranny of the country such that the effect is felt. But I have to commend the federal government of Nigeria. It's not easy because in Nigeria there are competing needs for health. We have also communicable diseases that we are battling with. We have the malaria, we have the cholera, and we also have the non-communicable diseases in which cancer is also one of it. So I will also encourage the government to do more such that this plan will also permit in every part of the country. Because I have to state it clearly here that although we are a developing country, we are having diseases of developed countries. And we are also maintaining our own primary diseases, communicable diseases. The incidence of cancer is increasing in our environment. And also, as such, I would like to encourage the government to put cancer at the front burner of its priorities so that we can get to the promised land. Thank you.
Thank you so much, Dr. Abubakar Bala, surgical oncologist and consultant general, Aminu Kano Teaching Hospital. We'll come back to you in the course of the program, but we would like to take a break now. When we return, Good Morning Nigeria continues. Don't go away.
All right, welcome back here on State. Good Morning Nigeria, reaching you live on the network service of the Nigerian Television Authority. We have a guest who will be joining us from Lagos. We'll introduce the guest presently, but in the meantime also we have tweets that have come in from our viewers, and we'll take those tweets now. Utula Sunday: cancer is a monster ravaging our communities, and we must do well to prevent, protect and control it in any way possible. We must emphasize on the causative agents such as exposure to chemicals, ionizing radiation, and some pathogens in order to minimize the rate of spread.
And from Mike Anyako, cancer is a very terminal and deadly ailment. Various governments through their agencies had initiated many programs aimed at curbing the disease, but a lot has to be done to treating cancer in our society. It is not responsibility of government alone, but it involves private individuals.
Law Alpha C. Cancer is a dangerous killer in this part of the world, as the cost of treatment is on the high side. Nigerians should be cautious in their dietary preferences, as cancer is on the rampage, afflicting people who consume anything consumable.
And Daily Jack Solomon tweets, more concerted efforts for World Cancer Day will help elevate the need for access to early detection and diagnosis as an enabler to precise treatment. Cancer is a global emergency, and each of us play our part in controlling the disease for the survival of mankind on planet Earth.
Festus Akimboyewa, there should be screening programs where Nigerians, especially those aged 50 plus, will be screened regularly. Early detection and diagnosis will reduce the number of cancer deaths in our country.
And Ahmed Mohammed says, as a preventive measure, the government should educate its citizens on the causes, effects and ways of preventing cancer through the media outlets, newspaper, social networks and You Report, etc.
Anoro Chukuma tweets, quality attention should be paid to cancer by advertising on daily basis, possible detection, early treatment and prevention. That will create some control to support the goals of cancer eradication.
And Clifford Agogwesi tweets, let's begin from the basics. How well organized is our health and human services system? To my mind, we currently have a chaotic system, and this explains why prevention, detection and treatment of maladies, including cancer, appear intractable. These are the tweets that came in just now, and before more coming, we'll be going to Lagos, Kingsley?
I'm not sure if our guest in Lagos is available now. Now, I understand, we understand that, yes, the signals to our Lagos Network Center are okay. Dr. Omalala Salako is joining us from Lagos as a consultant radiation oncologist. Dr. Salako, pleasure to have you with us on Good Morning Nigeria today. And straight away, I mean, you're joining us late into the program. Straight away, we've talked about a number of the causative factors and symptoms and all of that, the inadequacy of care facilities and all that. But there's a question that some persons are also interested in with regard to, say, breast cancer. Now, arising from the conversation surrounding the symptoms that a cancer patient will present, is cancer transferable by sucking on the breast, either as a baby or as an adult?
That's a very popular question. It's a myth. It's not true. It's completely unfounded. Whether a baby or a man sucks a woman's breast to prevent cancer or to cause cancer, that's absolutely not true. There's no science behind it. But there are many ways women can reduce their risk in developing breast cancer, and men have a role to play in that, starting with encouraging more women to go for their breast cancer screening. And it starts from age 20 years old, where a lady learns how to do her breast self-examination once a month. And once every 3 years, she should visit a doctor to get a clinical breast examination. And when she's 40 years old, then she starts her annual mammogram. And the advantage of a mammogram is that it can pick up some breast lumps 2 to 3 years before a doctor can detect it. So men and women have a role to play in the fight against cancer. And for those women who have breast cancer and have made it to the hospital, we need more men supporting their wives or their female relatives to get care early, to present in the hospital early, and ensure that they support the cost of that care. And as well as being a good listening ear, because these days our cancer clinics are filled with cancer patients who are not coming in with their family members. And it sometimes bothers us as clinicians what's happening on the home front. There are too many people presenting with disease that is unacceptable, and they are coming from somewhere. So there's also something about the community where they need to support people living with cancer, not stigmatize them, promote the right information, and then support
them to get the right care in the right hospital by the right doctor.
So, Omolola, I'm still staying with you. Apart from being a consultant radiation oncologist, you have also been at the forefront of the fight against cancer. You know, can you please tell us what is the level of awareness? Because they say cancer feeds on fear. A lot of people are afraid the moment they tell them they have cancer, it's a death sentence. They are looked at as if they have no, time to live anymore. 6 months, you'll be dead before maybe a year. So how have you been able to, reassure cancer patients of the fact that if given the opportunity and if a change of lifestyle comes into play, they might even live longer than they are supposed to live actually?
Absolutely. When it comes to a cancer diagnosis, a lot of people are scared, and that's because of the message out there. It's largely negative, and a lot of people play a role in this. We as clinicians, the way we also talk about cancer can be very scary. And as well as the myths and the misconceptions out there. So it starts with seeking the right information, and this is something, again, in the hospital we battle with. Why is it that a woman presents with cervical cancer, she's in renal failure, she's lost a lot of blood, she's got infection in her body, all from the cancer? Meanwhile, she should not even have this cancer, let alone have the complications I just mentioned. The thing is, many women do not know, many women and men do not know the right information about cancer, the benefits of screening, where to get screened. Our hospitals are stigmatized. Some hospitals are seen as if a patient walks in to do surgery or have chemotherapy, the patient is going to pass away or have a lot of complications, which is not true. And so my message is, every time we have the opportunity, like we all do today, to educate people about cancer, we need to let them know that first, cancer is preventable in 30% of cases, and the way you can prevent it is by being informed. Go for your medical checkup. From age 20, you should seek certain healthcare tests all the way through old age. The second thing is prevent cervical cancer. It's caused by a virus, which is sexually transmitted. And there are other viruses like HIV, hepatitis B, and human papilloma virus that can cause cancer. And so men and women have to be screened against this, prevent the infection. And for those who are already positive, get care. Back in the community, when we go to talk to men and women, we go with survivors, people who are living proof and testimony that they had been diagnosed a few years ago, and with adequate treatment, with faith, with prayers, eating well, having a balanced lifestyle. It's a mixture of everything. We're not just promoting treatment, but it's a whole spectrum of different things a cancer patient has to do to survive the disease. And I believe one day at a time we will win the fight against cancer. But we need Nigerians to be informed. If you have a lump in your breast, it's been there for 2-3 weeks, or any symptom that is persistent, please present to your doctors and know that they are specialists for certain diseases. You don't take a child with a headache to an endocrinologist. That's a diabetic doctor. You find a pediatrician. There's a bit of investigation Nigerians have to do to get the best health care, because back in the hospitals we are receiving our patients too late, and it's not as if they haven't presented to the hospitals. They have, but they've presented to the wrong hospitals or the wrong doctors. So there's that part where you have to seek for knowledge in the right places.
Thank you very much, Dr. Salako. But again, I mean, it's inevitable that we've had to discuss, as it were, the broad spectrum of issues relating to cancer. Our principal focus is on options in cancer prevention. West, we've talked about breast cancer, cervical cancer, but there's prostate cancer, which the experts say is specific to men. Dr. Bello, earlier you were talking about some cancers of the internal organs, cancer of the liver, for instance, pancreatic cancer, lung cancer, and several others. Are we on the path to preventing some of these types of cancers? I'm looking at just two issues. environmental factors. Everywhere you go, for instance, generator fumes, exhaust fumes from vehicles that ordinarily should be off-road because the combustion is not proper. And then you come to our dietary habits. On Good Morning Nigeria about 2 or 3 weeks ago, we discussed our harmful cooking habits. People using paracetamol to tenderize meat. You have all kinds of dangerous oils that people use on all kinds of things that they eat. So if yes, we have the challenge of diagnostic centers, treatment centers, but if we're not dealing with the prevention end as much as we ought to, it's almost inevitable that the system will be overrun. What should we do, therefore, to ramp up preventive measures?
So basically, we have what we call the 4 pillars of cancer care. And the number 1 pillar is prevent those cancers that are preventable. That's the first one. So yes, it is also enshrined in the National Cancer Control Program that we should institute things that will prevent cancers. And what are those things? The first, we've talked about screening. I will not go back into that. Screening for prostate cancer, screening for breast cancer, for all other cancers, including cervical cancer. If we can target the first 3 cancers in Nigeria, breast cancer, cervical cancer, and prostate cancer, we would have been reducing our incidence by 50%. Because these are the most important and the most prevalent cancers. All cancers that are as a result of infection are usually preventable, because if you don't get infected, you don't develop those cancers. We have the AIDS malignancies, the cancers that develop as a result of HIV infection. We have the stomach cancer that I said is caused by the Helicobacter pylori infection. We have the liver cancer as a result of hepatitis B and in some cases hepatitis C infection. And of course, the main culprit, the human papilloma virus, which is responsible for so many cancers, not only cervical cancer, but also oropharyngeal cancers of the mouth and the throat and all that and all that. So if we can actually prevent those infections, we will be able to prevent a lot of. And how do we do that? Now, there are vaccines. We do know that the National Immunization Program has, as part of the routine immunization, the hepatitis B infection, hepatitis 2B immunization. We are hoping that government will also include the human papilloma virus vaccination for the young boys and girls. And by so doing, we hope that in the near future, cancer of the cervix will be a thing of the past. Other African countries, Rwanda, they have institutionalized it. Kenya, they have institutionalized it. I don't see anything wrong with Nigeria going to Gavi. Gavi is the Global Alliance for Vaccine and Immunization. It's a world body, and they have the responsibility to produce vaccines. We can go and get it at a very cheap rate, and hopefully we should be able to institutionalize that. So if we can do that, the other aspect that I need to mention is lifestyle changes. We have laws that prevent people from smoking in public places, but are they institutionalized? Are they enforced? Cigarette smoking is responsible for over 20 types of cancers. So smoking is one of the things that we must be very serious about. You see that the Western world have abolished, smoking in so many places, putting too much taxes for the industry and so on. And that industry is moving to third world countries, including Africa. And if we don't put policies, strict tax regimes, they will come here in the name of investment. And before we know it, we will be down with lung cancers, breast cancers increasing, and so on and so forth. So smoking cessation is very critical, and excessive alcohol consumption. Companies are coming and they are building factories in the name of investment. And by the time you start to have serious alcoholism, then you are also going to have more cancers developing. So these are the things that we really need to look at so that we'll be able to prevent some of these cancers.
Can we talk about some of the palliative care measures taken into cancer treatment?
So palliation, where palliation is required, is the number 4 pillar actually of cancer care. And palliation can start from the beginning actually of cancer treatment. Take for instance pain. Pain management is very critical. Government must make it mandatory that opiates are provided in this country. Last 2 years ago, Nigeria was at the bottom last of providing pain management for its citizens because there was no single morphine available. And that's a shame of a nation. We should not allow that to happen. It's the most agonizing situation for anybody to die in agonizing pain. And we must make concerted effort that that does not happen. Radiation that Dr. Bala is talking about is used in so many palliative measures. Patients presenting with bleeding, if they are in Kano and they are bleeding torrentially and there is no radiation to palliate, that patient will exsanguinate. That patient will die losing blood. And these are things that we should do and make it a very important, critical aspect of our health care. It's amazing. If you can't treat, the basic thing you can do for a cancer patient is palliation. And I think we should take it very seriously, even if it means to start with palliation.
All right, Dr. Bello, thanks a lot. Dr. Fadiwele, again, I mean, you're president of the NMA. What can be done in terms of stakeholder engagement with regard to ramping up the prevention of cancer, either interacting with state and local governments as to what their own roles could be, or private individuals or other NGOs or other relevant bodies, so as to reduce the numbers that are presenting for treatment?
Thank you very much. Like what we did yesterday, we had an advocacy visit to the National Assembly where we met with the chairman, House Committee on Health Services, and his committee members. And what we decided to do was to see that we can have some policy through bill and through law that will make it mandatory for the government to do the needful. Unfortunately, like what a lot of people have said, is not having that beautiful paper, it is the implementation. For example, the National Health Act, as it were, where we believe that you need to implement it after, since 2014, a large chunk of it has not been, they have not been implemented. But let us start. First, let us make sure that we have some policy. One policy that every woman in this country, by the time they are attaining the age of 9 to 13, should have HPV vaccination is available. The government, either the local, the state, or the federal government, must put funding towards that. Again, we must also have a policy of having mammography on women 40 years and above, to make sure that every 3 years, or every 4 years, they needed to do that. We can actually input this in the National Health Insurance Scheme, which Nigerian Medical Association has been in the forefront that it should be made mandatory. As it is, National Health Insurance is optional. The percentage that it has covered is still less than 5% of Nigerian population. So we need to also work on that. Again, we need to do a lot of education. It has been established that one of the major causes of cancer, any type of cancer, is obesity. How do we eat? What do we eat? How do we live our life? Our lifestyle, which is very important. These are things that we should pass to the people. Again, another major cause of cancer is the indiscriminate use of drugs. Today we have all sorts of drugs that people are using. They are coming down with different ailments and different diseases, and some of them are carcinogenic.
And including processed food too.
Yes, yes. They are very carcinogenic because by the time the cancer develops, we do not have that time because it takes a longer time to relate it to what you have taken at those times. So we need to also control that. Again, we also need to establish lifestyle changes, like Dr. Bello have said, and I think it's important we put all those things in place.
Dr. Fadile, thanks a lot. Just back to Dr. Salako in Lagos. Tell us this. I mean, you've talked about HPV, and every other guest has also mentioned HPV and the vaccine that can be taken to prevent it. But Dr. Bello says that HPV is responsible not just for cervical cancer, but other forms of cancer. Is that correct?
Yes.
So, is it therefore advisable for men and women to both take HPV vaccine?
Absolutely. And this is a low-hanging fruit because with HPV, girls and boys from age 9 to about 14 have the most benefit of the vaccination compared to women or men in their adult stages. And this is because the vaccination is most potent when the child has not been exposed to the virus, which is usually gotten through sex or very close skin-to-skin contact. For hepatitis B virus, it causes liver cancer, and healthcare professionals are at risk. People who exchange needles, like drug abusers, and through blood transfusion, as well as mother-to-child transmission during child delivery. These are ways hepatitis B virus can be transferred, and it's important that people get vaccinated against this virus. And to the third virus, which is HIV, and it's very common. HIV basically suppresses the immune system, and so when the immune system should fight a foreign body like a cancer cell, the body is unable to do so because the system is deficient. So it's important that first, observe the ABCs of sex, abstain from sex, be faithful, use a condom. In case you are HIV positive, then there are certain cancer screening tests you have to do. When we compare the HIV population to the non-HIV population, they tend to do their cancer screening test earlier. And they're just, you must adhere to your drugs so that you can beef up your immunity. And so these are, as Dr. Bello said, this is actually a low-hanging fruit for many Nigerians to prevent certain cancers.
Thank you so much, Dr. Omolola Salako, consultant radiation oncologist. We thank you so much for joining us on Good Morning Nigeria. And Dr. Bello Abubakar Mohammed, President, African Organization for Research and Training in Cancer. It's always a pleasure to have you join us on the program. And Dr. Francis Fadiole, President, Nigerian Medical Association, thank you so much for coming. And from our Kano studio, Dr. Abubakar Bala, surgical oncologist and consultant general surgeon, Aminu Kano Teaching Hospital, thank you so much for coming. And from our Enugu studio, Dr. Nwanko Kenneth Chima, consultant radiation oncologist and head of Radiation Oncology, University of Nigeria, Enugu. Thank you so much for coming on Good Morning Nigeria. Sports update is next.
Well, Jumai, I think we're already pressed for time. And just one point, I mean, we signed up for all our guests. You see it in urban Nigeria, persons, with some swollen parts of their face or some swollen parts of their body, they are using them as beggars. And obviously, I mean, somebody who is not a medical personnel would know straight away that this is a case. I wouldn't know whether that's cancer or otherwise, but oftentimes, instead of going to the hospital for treatment, they are using them for begging and collecting money on the streets. All right, we hope
anybody that wants to help them should actually take them to
the hospital. All right, yes, so we hope you found our program very useful today. Thanks for being with us. We are back tomorrow, 7 o'clock in the morning. Until then, enjoy the rest of your day. I'm Kingsley Osadolo.
And I am Juma Yusuf. I am and I will. Thanks for watching.